Squish. Hello, Mr. Fung. My name is Ryan. I'm a nursing student today. I'll be conducting a head-to-toe assessment on you today. Okay?
Sounds good.
Great. Can I see your wrist? Can you tell me your name, date of birth?
Zachary Fung, January 2001.
Great. And do you have any allergies I should know of?
No.
Okay. So like I said, I'll be doing a head-to-toe assessment, requiring me to inspect, palpate, or touch, oscillate, or use my stethoscope to listen to those areas, as well as I'll be asking you to do a bunch of range of motion stuff. And then I'll be putting some resistance on those range of motions to test your muscle strength. Are you okay with all that?
Sounds good.
Great. And if you feel any pain, distress, or discomfort throughout this whole process, let me know. We'll stop, let you gather yourself, and then continue on when you're ready, okay?
Okay.
All right, so we'll get started. Just doing a general assessment on my patient. Patient in an upright body posture. He's an overall calm demeanor about himself. He appears to state age. He does not look like he's in any pain, distress, or discomfort. And he has no obvious skin lesions or open sores or wounds that are visible to me right now, such as on his face, upper extremities, and lower extremities. And nothing else, wounds or anything like that. Okay, so now I'm going to just do some basic questions for you, Mr. Fung. These are meant to help guide my assessment, so just answer them to your best ability, okay?
Okay.
So starting with your integumentary system, do you have any skin diseases, infections, or traumas? All right. Do you have any excessive dryness or itchiness?
No.
Okay. For your respiratory, do you have any shortness of breath or difficulty breathing?
No.
All right. Do you have any coughing?
No.
All right. For your cardiovascular, cardiopulmonary, do you have any congenital heart problems or heart diseases?
No.
Okay. Do you have any chest pain?
No.
Okay. For your GIGU, have you ever had any abdominal surgeries?
No.
Okay. Do you have any abdominal distension or bloating?
No.
Okay. For your musculoskeletal, what do you do for exercise?
I run and work out.
Okay. Do you have any muscle pain?
I have a little bit after I work out, but it goes away pretty quick.
Okay. So does that muscle pain affect your activities of daily living?
No.
Okay. For your neuro, have you ever had any seizures or strokes?
No.
Okay. And are you experiencing any numbness or tingling right now? Okay, great. Thanks for answering those questions. Now we're actually going to go on to the actual assessment, okay? Starting with your head, can you raise your eyebrows? Can you wrinkle your forehead? Can you smile? Puff out your cheeks? Can you show your teeth? Great. So for this, I was assessing the patient's facial nerve or cranial nerve 7, which is intact, and all his facial expressions were symmetrical. Okay? So next thing, Mr. Fung, I'm going to go look in your mouth. I'm going to do a quick inspection of your lips. Can you open your mouth? Okay, great. All right, can you put down your tongue so I see the back of your throat? All right, can you say ah?
Ah.
Okay, and can you stick your tongue out? All right, can you put your tongue back in and lift up? Great, okay. So patient's lips were smooth, moist pink without any obvious lesions. Patient's teeth are in good repair. Patient has no missing teeth, no obvious dental caries, and his gums were pink and moist. Okay, patient's buccal and oral mucosa were pink and moist as well, with no obvious lesions. His tongue was pink and moist, smooth, and midline. His uvula was visible, and it rose and fell when he said ah, and his tonsils are 1+ non-injected. Okay, so Mr. Fung, the next thing I'm going to do is I'm going to do a quick look at your eyes. Is it okay I pull down your lower eyes real quick?
Yep.
All right, great. Great. All right. Patient's conjunctiva were clear. His sclera are white with no obvious discharge. Okay? Mr. Fung, the next thing I'm going to do is I'm going to go use my pen light here to look at your pupils, okay?
Okay.
Yeah, there, right? Great. All right. And can you go look at the wall real quick? And I'm going to ask you to focus on my finger now. All right. Great. All right. So patient's pupils were equal, round, reactive to both light and accommodation. And Mr. Fung, the next thing I'm going to ask you to do is I'm going to ask you to look at the tip of my pen light here. And without moving your head, you just be moving your eyes, okay?
Okay.
Right. Okay. All right, great. So for this, I was testing patient's ocular motor, trochlear, and abducens of cranial nerves 3, 4, and 6. Which were all intact. Patient's eye movements were smooth, rhythmical, parallel, and without nystagmus. Okay? So, Mr. Fung, the next thing I'm going to ask you to do is if you can take your shirt off, I'm going to be listening to your heart, okay?
Yeah.
Great. So, as we listen to your heart, first spot I'm listening for is your second intercostal space.
Yeah.
Right sternal border, this is your aortic. S2 is louder than S1, no extra heart sounds or murmurs, regular rate and rhythm. All right, now I'm going to go across your sternum to your second intercostal space. Left sternal border, this is your pulmonic.
Okay.
S2 is louder than S1, no extra harsh sounds or murmurs, regular rate and rhythm. All right, and I'm going to go down to your third intercostal space, left sternal border. This is your Erb's point. S1 is equal to S2, no extra harsh sounds or murmurs, regular rate and rhythm. We'll go one more down to your fourth intercostal space, left sternal border. This is your tricuspid. S1 is louder than S2, no extra harsh sounds or murmurs, regular rate and rhythm. All right, I'm going to go down one more to your fifth intercostal space, left mid-clavicular line. This is your mitral, by the way.
Yep.
S1 is louder than S2, no extra harsh sounds or murmurs, regular rate and rhythm. All right, now I'm just going to go look at your upper and lower extremities. If you can just hold your arm out for me real quick. Can you rotate them? Great. I'm going to palpate real quick. Is that okay?
Okay.
All right, do you feel any pain?
No.
When I press down?
No.
Okay. Okay, capillary refills. All right, I'm going to check your radial pulses. Okay, great. I'm going to go do your lower extremities real quick. Is it okay to roll up your shorts?
Yep.
All right, great. I'm going to do a quick inspection. All right, I'm going to palpate real quick. Is that okay?
Okay.
Okay, any pain?
Nope.
How about here?
Nope.
Great. Here?
Nope.
Okay. All right, I'm going to check your capillaries. Okay, and now I'm going to check your pedal pulses. Okay. All right, any pain or tenderness throughout the whole thing?
No.
All right, great. Patient has no signs of pain or tenderness upon palpation of his upper and lower extremities. Overall, his patient has proper skin pigmentation for his ethnicity. Overall, his skin for his upper and lower extremities were warm and dry to the touch. His upper extremity and lower extremities were symmetrical bilateral, with capillary refill less than 2 seconds for both his upper and lower extremities, and no signs of edema or erythema can be noted for upper and lower extremities. And for patient's upper extremities, his radial pulses were 2+ equal and bilateral, regular rate and rhythm. And for his lower extremities, patient's dorsalis pedal pulses were 2+, regular rate and rhythm, equal and bilateral. Equal and bilateral for the radial pulses as well. All right. So that's it for your upper and lower extremities. Mr. Funk, do you have any questions for me so far?
No.
No, you're not worried about anything?
No.
All right, great. So for this, I was just asking questions for the patient just so I can observe his breathing without him knowing. Patient's breathing looked regular, relaxed, unlabored, and spontaneous without any accessory muscle use. Okay? So Mr. Funk, the next thing I'm going to do is I'm going to use my stethoscope to listen to your lung sounds, okay?
Yeah.
All I ask you to do is anytime you feel my stethoscope touch your chest, just take a deep breath in and out of your mouth, okay? Okay, you sit up straight up. This is your right upper lobe, left upper lobe, left upper lobe, right upper lobe, right lower lobe, and left lower lobe. Great. I'm going to do the same thing on your back. If you just turn a little bit.
Yeah.
Once again, take a deep breath, okay?
Yeah.
This is your left upper lobe, right upper lobe, right upper lobe, left upper lobe, left lower lobe, right lower lobe, right lower lobe, left lower lobe. All right, and then your right middle lobe. Great. All right, so patient's lungs were cleared to auscultation. No adventitious breath sounds can be heard, and no rhonchi, wheezing, or crackles can be heard as well. Okay, so Mr. Fung, that's it for your lungs and respiratory. I'm going to ask you to lay down real quick so I can start your abdomen, okay?
Yeah.
So I'm going to do a quick inspection. All right, patient's abdomen is flat, non-distended. Umbilicus is midline. He has even skin pigmentation and no signs of lesions, erythema, scarring, or bruising. And no obvious hernias or pulsations can be noted. Okay? Mr. Fung, just want to let you know that when I do an abdominal assessment, I divide your abdomen into quadrants, vertically right here and horizontally right about here. Just to let you know, this is going to be your right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay? Great. With that in mind, I'm going to use my stethoscope to listen to your bowel sounds in each of those quadrants. Okay?
Mm-hmm.
Great. All right, so you just have to sit there. All right, great. Patient's bowel sounds are normal, active. Just to let you know, Mr. Fung, if I do not hear any bowel sounds, I would have to listen to each quadrant separately for at least 5 minutes to fully determine if the bowel sounds are absent. But since I heard bowel sounds today, we don't have to worry about that, okay?
Sounds good.
Great. Next thing I'm going to do is palpations. I'm going to press lightly and deeply. Just let me know if you feel any pain, okay?
Yeah. None. Nothing. Nothing. None.
Okay, now I'm going to press a little bit deeper. Once again, let me know if you have any pain or tenderness.
Yeah. Nothing. Nothing. Nothing.
Any pain?
Nope.
All right. Patient has no signs of pain or tenderness upon palpation, both lightly and deeply. His no abnormal masses can be felt. Minimal rigidity and he has equal and bilateral muscle tone throughout his abdomen. All right, Mr. Fung, the last thing I'm going to ask you to do is, can you sit up? I'm going to go do some do a little tap on your costovertebral angle.
Yeah.
Let me know if you feel any pain, okay?
Nope.
Okay, one more.
Nothing.
All right. Patient has no signs of tenderness upon percussion of his his costovertebral angle. Okay? So if you want, you can put your shirt back on. We're going to go on to some range of motion stuff, okay?
Okay.
So just follow my motions exactly, okay?
Okay.
So we're going to go flexion, extension, adduction, adduction, external rotation, internal rotation, flexion, extension, supination, pronation, wrist flexion, extension, ulnar deviation, radial deviation, hand flexion, hand extension, abduction, adduction. Great. Patient's full range of motion of his upper extremities. His shoulders, elbows, wrists, hands are all in alignment, symmetrical bilateral. Okay, now we're going to go into your lower extremities. And you go up for flexion, down for extension, out for abduction, in for adduction, internal rotation, external rotation. Great. Kick out for knee extension, back in for flexion. Ankles, we're going to push up and push down. All right, and on the outside is an inversion and then eversion. Great. Patient has full range of motion of his lower extremities. His hips, knees, ankles, and feet are all in alignment, symmetrical bilaterally. Okay, so now I'm going to put some resistance on those. Can you hold my hands? Can you push me away? Flexion, back in for extension. Great. Out for abduction. Back in for adduction. Great. Out for external rotation. All right, back in for external rotation. Great. Try bicep curl. Flexion, down for extension. Great. And then for your hands, don't let me squish your fingers together, okay? Okay. And then squeeze my hands real quick, as hard as you can. Great. Patient has muscle strength for his shoulders, elbows, and hands are 5 out of 5, equal and bilateral. All right, so now we're going to go on to your lower extremities. Put your legs up, flexion. Great. Back down for extension. All right, out for abduction. Great. In for adduction. Great. Kick your knees out for extension. Great. Back in for flexion. Great. Push your feet up for flexion. Back down for extension. Great. Patient's hips, knees, and ankle strength are 5 out of 5, equal and bilateral. Okay? So, Mr. Fung, that is all I have to do for you today. Do you have any questions before I head on out?
Nope.
All right, you have a great rest of the day then.
Thank you.
Squish.